Welcome, everyone. We are excited to have you with us today. We are recording our session, so thank you for joining us. To save bandwidth and for the recording, we do ask that all of our attendees turn off their cameras and mute themselves during the presentation. I will be monitoring the chat, so you can share your questions here, and I will share them with our presenters. Nancy Heron is running tech for us today. Thank you, Nancy. As I said, we're recording the session, so if you're uncomfortable with your name showing, you can change it to anonymous and then private message Nancy so she can check it on our attendance. Also, if your Zoom name doesn't match the name you registered with, please change it or let Nancy know. Let me go ahead and do our land acknowledgement. Texas Children in Nature Network is headquartered in Austin, and as such, I'm on the ancestral and unceded land of the Tonkawa, Comanche, and Sauna people. Our ongoing colonial presence on Indigenous lands compels us to take action now to counteract the effects of colonization. The work we do through the Texas Children in Nature Network is one small step towards that effort. I'll put a couple of links in the chat in just a moment about land acknowledgements and about those people groups. And finally, I'd like to welcome our speaker today. Dr. Amanda Mohammed is a doctor in the Dallas-Fort Worth area and a leader with the Walk with a Doc program. Happy that you could join us today and take it away.
Perfect. Thanks, Sarah, and welcome everybody. I'm really excited to talk to all of you about Walk with the Doc. And as Sarah mentioned, I am from Dallas. I am a new addition to the Texas Children in Nature Board this year. And having grown up in the Dallas area and thankfully being able to practice right in my home turf, I've been really trying to look at different ways to be an advocate for my patients and for my community. And Walk with the Doc, it has been such a privilege and an honor to be a part of because it's allowed for me to give back and also to advocate for wellness across the board. And what better way to do that than, participating in community activities and also nature within our own areas. So I do want to, open the floor whenever you guys have questions. Just like Sarah said, please feel free to drop it in the chat. I want to make for sure that you take away from this presentation more of a holistic understanding of what the organization does. And I have taken a lot of, information from the website and also just anecdotally some examples and experiences that I've had over the last 2.5 years being a Walk with the Doc leader here in Dallas. So let's get started. So as far as Walk with the Doc is concerned, we have been having the privilege of leadership when it comes to the organization through Dr. David Sapir. So he is a physician that is located in Columbus, Ohio. He actually started the org in 2005 with a premise behind it to get more involved with his patients. And instead of just, talking about the importance of exercise and the many benefits of exercise, he decided it would be more tangible to go ahead and try to walk with his patients instead. And so what started out as just, a little invite for one patient or two patients grew over the years. And it is just so that everyone is aware, an official 501c3, the whole premise is building, the program so that it can be implemented around the country. And amazingly, it has now transformed. There's more than 500 chapters worldwide of Walk with the Doc. And there's also other chapters that feature soon-to-be docs that are called feature doc chapters that are led by physicians through different medical students that have, come across the organization and want to also start in their own communities. I have a short clip that I did want to share that does explain the premise behind why Dr. David Sapir started the organization. One also note is that he was honored back in 2015 of being a CNN hero. So as you can imagine, just with all the endeavors that he's made, he's really helped transform many patient lives. And now that's stemmed all across the country. So here's just a quick little clip.
Amanda, I don't think we can hear it.
Oh, you can't? Oh, no.
If you stop sharing and then click share screen again.
Let's see here. So stop sharing.
Yeah, and then when you click share screen, you'll see under those boxes, you'll see share sound. There's a little click box. So click that first and then click the screen with the PowerPoint slide.
Okay, share sound and then go back to the screen. Yep. All right, perfect. Let's see if this works instead. Is that better?
Got it.
I knew something had to change on my end to stay healthy. I go anywhere between 9 to 12 hours, all sitting at the desk. You may be working a lot, but you're at the desk sitting.
How far do you think you could walk before you had to stop?
The number one problem I see my patients face as a cardiologist is a sedentary lifestyle. I was frustrated at my ineffectiveness to create change in my patients.
Hello. How are you?
I'm fine.
So I said, how about if my family goes to the park, would you be interested in joining us? So we'll see you tomorrow at the walk.
Oh, yes.
The response was phenomenal.
I wanted to talk about how easy taking care of ourselves can be.
There's no better way that you can show a patient that you care about them than by going the extra mile with them. There's no wait in the office. There's no fear of bad news. It's just the patient and the physician talking about whatever the patient wants to talk about.
In the beginning, I used to walk a mile or two. By end of the year, I've completed a full marathon. I'm thinking of signing up for my second marathon. Dr. Sabgir taught me you can achieve things that are really big, but it all starts with small steps.
How many miles do you have in already?
2.7.
80% of cardiac disease is preventable if we just go for a walk. If people just take that first step, they will never look back.
Okay, and you guys can still hear me now?
Yes.
Okay, perfect. So as you could see, just, in that short clip, I wanted to introduce, Dr. Sabgir, so you all had the opportunity to seeing, the person behind the name of the org and how important it was for him to get started and the mission focus that he had. Walking, of course, is recognized by the U.S. Surgeon General as the single most important thing that we can do for our health. But the thing is, how can we make that accessible for everyone? That's the key thing. And through Walk with the Doc, we really are trying to inspire communities through movement and conversation. But we also have to recognize that this isn't something that can be completely transformed in certain communities because of a lot of different barriers. But it doesn't mean that those barriers can't be broken. So when we start talking about the why behind the walk, there's so many benefits. As Dr. Sabgir mentioned, the cardiac benefits and overall wellness are exponential. So there's physical and mental benefits, maintaining or obtaining a healthy weight, and of course, as was mentioned about the cardiovascular disease and even cancer, decreased blood pressure and improved cholesterol, the prevention of diabetes and management of it, and arthritic pain. And another key one is lowering the risk of depression and improved mood. I definitely feel maybe all of us here on this call can attest to the early days of the pandemic and not being able to really be interactive with anyone outside of pretty much our bubble, maybe our close family or friends, and not having that interaction has limited a lot of people. And when it comes to their health and being able to exercise specifically, it did take quite a bit of a hit and also increased a lot of risk when it comes to mental health. So what Walk with the Doc mission overall is, of course, to encourage physical activity and to reduce the whole sedentary lifestyle mentality. But we've also found that we can really transform the lives and communities around the world. So creating something sustainable by inspiring communities is important. And you all come from various areas throughout the Texas region, and I'm sure have so many different possibilities of what you can do in your own areas. The great thing is because the organization has been around since 2005, there are so many people that have had multiple areas of experience and starting Walk with the Doc in their own community and have found ways to engage their population there. So when it comes to inequities within healthcare, there's numerous, from anywhere from transportation to different barriers when it comes to health literacy and financial access and resources. This is, trying to get everyone on a same playing field when it comes to health equity. And I've had numerous patients, just anecdotally, that have, participated in my walks, and they felt so much reassured about, someone such as myself, being their physician, caring about them enough to reach out to them outside of a clinical, room and environment to, encourage them to be a part of this type of community where we're all engaged and really proactive about our health. So we're targeting all communities, and especially those that are underserved and marginalized. So I do want that to be, a huge focus in terms of moving forward and thinking about ways that you all can participate and give back in your areas. When we look overall at the impact of Walk with the Doc over the years. So this also, I don't believe, is completely updated. I think this is from 2017 data, but there are about 500 or so chapters that are across the world, and 46 specifically in the US and 37 countries. So, I mean, you can only imagine what that impact has been, and of course it looks different no matter where you are. But the whole idea is that everyone's welcome, all ages, all backgrounds, all physical abilities, and, community members, patients, whomever you can get out there to walk. So you can see that the gray areas are areas that still don't have a Walk with the Doc yet. So still room to grow. When we start looking at statistics per year about how many walks there are, specifically to the United States, there's about 8,200 or more walks that have been able to be calculated. And in terms of how many visits per year each walker does, 129,000 or more. That's incredible. And, it sometimes can feel, I know when I first started Walk with the Doc, this was 2.5 years ago, of course I had, a slow kind of lull period, and then it built up. I initially started, of course, just kind of recruiting family and friends, and then went into, our clinics and started printing out resources and making that a part of my day-to-day, language when it came to educating patients about the importance of exercise. So they always left with some information about when my next walk was, and a lot of people would slowly, start coming, and then it just grew and grew and grew. So it can start off with few, but then that doesn't mean that it can't build up. And you can always participate with other folks in the area too, other healthcare professionals, partner with other, people in the area that you feel may have even more of a presence, just to get more engagement. So as you can see here, when it comes to just education in general, 90% of polled participants felt that they were more educated since starting Walk with the Doc compared to not being a part of, the organization before. And that's huge. A lot of folks do leave our walks knowing more than, of course, before they came. And there's so many various topics that you can, decide to speak on. whenever the walk happens, what's generally done is that you'll have a physician or a healthcare professional go ahead and open with introductions to why, we're doing what we're doing with Walk with the Dog, just like I've done. And then we'll go off of a topic that sometimes is chosen beforehand, maybe by one of the participants from the month or weeks before. And we'll talk on that said topic for about 5 to 10 minutes. And then we'll go ahead and start our walk. And so the topics can range from, let's say, high blood pressure, cholesterol, monkeypox was something that came up recently. Of course, with the COVID pandemic, about vaccinations. So there's various topics that can be discussed, and people leave definitely much more informed. And then when we start talking about, of course, the benefits of exercise. So I've definitely polled my patients also just to see, if you are coming to Walk with the Dog, are you doing more than just coming once a month, which is when I have my walks? And yeah, a lot of people are exercising way more than once a month, which is great, and it should be. So 9 times out of 10, you really want to aim for at least 30 minutes of walking a day, 7 days a week. That's what's recommended. And so when looking here statistically at the exercise data, 71% of participants get more exercise since starting Walk with the Dog, compared to just about 27% that have just maintained a regular level of activity. So that's also, a monumentous, accomplishment. That's very important for people to have that, again, sustainability in their own right, and feeling that motivation to exercise even outside of the program. They see the benefits. So again, just kind of looking at some comparison data, when you look at the national average in the left upper hand corner compared to Walk with the Dog participants, and when we're looking at the recommendation of at least 150 minutes per week of exercise, which is 30 minutes per day on average, we look and we see that Walk with the Dog participants are far exceeding what is the national average. So 40% of Walk with the Dog participants are actually getting the recommended activity level compared to others that are not a part. And, I feel that having that opportunity to be a Walk with the Dog leader gives you even more of an ability to inspire other people to do the same thing in their community, hence why even being asked to do this webinar was such an honor. I feel that being able to give like-minded individuals that are focused on the enhancement of knowledge, being able to empower people about the importance of getting out there in nature and exercising daily really makes me a better doctor, makes me a better person, an advocate for my community. And the more you have people that are doing that are across the country, across even the world, as we saw, I feel that, you're going to be able to make such a huge impact. So the top
Dr.
4.
Mohammed, we do have a question about the participants, if you don't mind.
Oh, sure.
So we have a question from Melody in the chat. She's asking, are these generally adult or family-oriented walks?
Yeah, definitely great question, Melody. It is family-oriented. I have folks that bring their kids. I think the youngest participant we had was technically 2 months old in their stroller. And so, yeah, it's very family oriented. We have people bring their pets, no one is, excluded, it's very much a wide range. We have kids, adults, and everything in between. And we encourage that, right? Like we definitely want children to be as proactive when it comes to their health and their wellness as the adults, and adults, of course, leading by example. But yeah, that's a great question, but that is definitely something that we encourage. Anything else?
That's all we have in the chat right now.
Okay. So yeah, the top 4 reasons that people participate, as you guys can imagine, so the health benefits of exercise, which we touched on, of course, the health education component, camaraderie, right, of being with others. Like I said, people were missing out on that, tangibility and that ability to be able to interact with folks face to face, especially in the heart of the pandemic. One thing that I'll make a note of that I really found very creative by the organization is during that period, we actually did virtual walks. And so I have a few of them that I've done that are available, on YouTube. And they ranged from, talking more about the importance of vaccines and, getting flu shots. There's just so many different things, and, encouraging people to not only listen to the topic, but to go walk thereafter with their family or friends. So there was a level of communication that the organization was still trying to maintain, and I feel that they did a great job of making sure that people were not lost during that period. And then the fourth reason that people tend to participate is being out in nature, right? We know that there's so many benefits of being out and outside of, your home and being able to be in nature, and just the substantial benefits that it does in terms of improving your mood and your energy level. So those are those top 4 reasons. And as we kind of touched on a little bit earlier, and just in terms of how often you should walk, so I think you guys got that down at this point, 150 minutes of exercise, at least moderate intensity exercise, is recommended per week. And then also, when we talk about what is moderate intensity, the talk test is a good way to find that out. So if you can talk but can't sing, you're doing good. So whenever we're doing our walks, we meet up in the Dallas area. For any of you that are local or familiar with White Rock Lake, we meet at the Bath Cultural Center at usually 9 in the morning on a Saturday, once a month. And we, start off, just like I said, with the topic of discussion, and we'll walk maybe about 25 minutes or so along the lake, and then 25 or so minutes back. And I do test this out because, people will ask me questions, and that's great. We encourage that. We want that dynamic. Ask questions related to the topic or outside of the topic. And if I can talk but not sing, I know I'm doing good. And then as far as just pairing with 2 days a week of muscle strengthening activities, just a few examples of what that would look like. If you like to cycle, if you like to dance, lifting weights, even just some heavy gardening like digging and shoveling is also a good way to get in those 2 days a week. As we mentioned, children, we don't want to leave our kiddos out. They should be participating in at least 60 minutes of physical activity daily. And, it doesn't matter, what it is, right? If you're moving, you're doing great. So whatever you like to do, I always encourage my patients to do. I know a lot of people will say, oh, I have to do this exercise in order to get healthy. And that's not true. As long as you're doing some kind of form of activity that is, hopefully recommended by your physician, so that there isn't any issues going on that could get worse, then, you should be encouraged to continue that. And just a few things when it comes to the core beliefs of the organization. I'm not going to read through every single line, but just some key highlights, right? So we do really, truly believe that walking is medicine. There's just too many benefits. No one can ignore that. And it does have the power to change people's lives, as in that video that you all watched at the beginning. You had someone who wasn't walking really much at all, and now they're doing marathons. So it really can change the trajectory of someone's life. Also, just empowering people within the community to take, charge and take that initiative of transforming healthcare through prevention. I am a family physician. I work in geriatrics right now. But as a family practitioner, we are very focused on preventative care. I always tell people that come into the office, I'm so proud of you. I'm so happy that you're here, because that just shows that, number one, you care about where your health is and you want it to get better. So ways that we can help prevent different risk factors are important. And walking is such a huge start and a great direction for that. So when we start talking about all the benefits of walking, I did want to also show just a small little clip. There is a film that was created with Walk with the Doc called the Alternate Route Trailer. And it's really great. It's a documentary film that basically shadows the members and the founders of the Walk with the Doc program. And so it offers a lot of statistics just about the barriers that constrain the development of meaningful and tangible relationships between patients and doctors' relationships, but also there's a lot of evidence that links the benefits of walking to better health outcomes also, as you can imagine. So there are people, that are featured in the film that talk about their personal experiences with that. So I think the sound should still be good. So I'm just going to play this quick clip here.
Unfortunately, in the office, probably anecdotally, about 5% of people are living an active lifestyle concordant with what the guidelines recommend at 150 minutes a week. One day I said, what if my family and I join you at the park? Would you have any interest? And that was really kind of a magical moment.
Doctors, when you go to doctors' offices, they got the white coats on, or you feel there's, it's hard to talk to doctors, I feel.
But I think the biggest thing is just being able to feel like you can go up and share about any particular health concern that you have.
And I think when you go to Walk with the Doc, it doesn't matter. You don't have to have the fanciest shoes, the fanciest clothes. You just go up and show up, and there's people of all abilities that are there.
The idea is so simple, right? You have a physician or two, along with some of their staff, organizing a walk. And the idea there is to involve the community around them.
We want our community members that come to the walks around the country to feel that they're in charge.
I walk
Because
I need to walk.
Meet new people.
I'm inspired by what I see.
To spend more time with my patients.
So yeah, so you can see, the tremendous benefits of having something like this on a regular basis. And just, as an aside, because I know a lot of people wonder, gosh, okay, like how much of a time commitment is this? And I'll tell you, as a full-time physician, I love, to make time for this, and it's literally an hour once a month. So it's not a huge time commitment, and you can do more frequently if that's something that you wish to do. There are some physicians locally that I know will do it bi-weekly. I know that there were a few once upon a time that did it weekly, and things can change, right? And especially depends on the season that we're in. Of course, Texas heat can be such a huge barrier, and we'll talk about that in just a second. But I do want to encourage you all that, it can look different. It doesn't have to look like other people's walks. It's whatever you make of it. And I would say about 40% or so more people, tend to gather even more than just once a month. And sometimes that can be formal or informal. I know some of my participants, sometimes they'll meet up outside of my walks and, just go throughout their own community neighborhoods and, start walking. So just a heads up about that.
Unfortunately, in the office, probably anecdotal.
Go here. So yeah, this is something that we've already talked about. I think that you guys can take away the top 4. So exercise, health, education, social connection, and nature. So when we start talking about what we can do in our own communities, as I said, things can look different for everyone here. I know that as far as a space goes, personally, we use White Rock Lake, a local lake and park here in the Dallas area. I know of also other Walk with the Doc leaders that use their own neighborhoods to do their walks. And so they'll just meet up at a common point location Nature trails are also great ideas to do in the areas that you're located in. You can also partner with state parks and local organizations. I have not yet done this, but I know that there have been people that have done this. And with the Walk with the Doc leadership and the resources that are available on their website, which I will show you towards the end of the presentation, there are ways to connect with people in your surrounding areas that are more, at a state and local level. The whole idea about, our Texas heat, I know has come up many times and I know is a concern. And, we do have to be cautious whenever we're doing our walks. I know that we've gotten really creative with just the timing of our walks over the years to avoid, the really early mornings and trying to just look at the weather updates to make for sure that we're walking at least the most ideal time. But yeah, you can definitely pick, the location that's best, suited. You can also, do those virtual walks like I was talking to you about, and do that and partnership, just kind of with a local organization, if that's something that, is more appealing at the time. Also, local gyms. I've heard people walking in malls and different recreation centers, also considering night events too, depending on where you are located and the safety and how well lit the area is. I know that because, especially now that I do work in geriatrics primarily, you do have to, stay aware of different, limitations that some patients may have and not, push them beyond their limits, right? We don't want anyone to get hurt. I have gotten really creative in other ways of doing sitting exercises, and there's so many different resources out there just so that we're not, feeling like anybody could be excluded. There's always something for someone to do. Also, just like some quick tricks too, just to keep in mind when it comes to heat is, making for sure just to, whenever you're going on walks, just listening to your body. If you're having a day where you're not having as much of an increase in your fluid intake, you don't want to push it, right? No one wants somebody passing out from heat exhaustion or heat stroke, which are very, very common, of course, here in the Texas area. So who can join Walk with the Doc? So as Melody asked a few minutes ago, which was a great question, but everybody can join. It does not matter. And in terms of just fitness levels and backgrounds, you're always able to just talk to participants before they actually go on the walk to see, how they're doing. If you feel like they are in a position where they would have any concerns or any issues with the walk, and you can have an abbreviated one too, just depends on what's going on. It is a free event as well. There's no registration necessary. A lot of people tend to ask that. And so whenever you sign up to be a walk leader, there is a fee that you pay. Don't quote me on the exact cost, but I believe it's around $600. However, there is a lot of funding and sponsorships for people to be able to have this, work in their community. So that should not be a barrier. If it is, or if you're worried about that, you can easily talk to one of the leaders through, their email addresses that I can provide for you if needed, and they'll work with you on that. As far as, just who could be a leader, I know that that's also come up in the past in terms of, if you have to qualify to be, someone that can actually lead these walks. And as I alluded to before, we have future doc chapters that are led by physicians and medical students. We also have a chapter of Walk with the Doc called Just Walk, and that's led by other healthcare professionals that are licensed. And of course, Walk with the Doc, as I'm speaking of now. So there's different opportunities out there. So I just don't want that to seem like that could be a barrier for folks to not participate. And then, as I said, earlier, what happens during the walk itself. So at every event, you know, there's a brief discussion, you walk, you talk. I know that often as well, I've been brainstorming different ideas to incorporate blood pressure clinics at the beginning of the walk, and just checking folks, you know, their readings and letting them know what's normal, what's not normal, and when to follow up with their physician. So there's different ways you can be creative. We have healthy snacks available, of course, tons of water. And when you are a leader, you do get a lot of what we call like walk with the doc swag. So from t-shirts to really cute prescription pads that actually have prescription pads that are, you know, obviously not able to be used, but used for the purpose of writing exercise as a daily medication. So that's really cute and encouraging. All kinds of, you know, kind of goodies that you can give out throughout the year. So as I said, you know, it varies depending on what you want to do. It can be weekly, bi-weekly, or monthly walking opportunities. This photo of me right here is actually at my local library. And so I actually gave a talk about Walk with the Doc at my local library in Rowlett. And there were tons of kids that showed up with their parents. It was a great experience. We were talking about how exercise changes you, like before and after, and your energy and alertness, and different risks that can happen when you don't exercise. That's why arthritis was written on there. So there's so many ways that you can really give back and educate folks about the benefits of exercise. Partnering with an organization also, you know, choosing a day and time that works best for the population that they serve is also a good call out. And I wanted to show you all the website real quick. So if you want to find the closest Walk with the Doc that's near you, and there may not be one just yet, but that's okay, because you can start one. But you'll see here on the website, which is walkwiththedoc.org, you can go to locations, and it has a map of everywhere across the country. And so it is coded by what type of chapter. So Walk with the Doc chapters in blue. And then you also have green. That's the Just Walk that are led by other licensed healthcare professionals. And then here in orange, the Future Doc chapters. And so you can also scroll down and just click, you know, whichever area that you're in. So if we click Texas, and then you can also kind of narrow it down by zip code. So I live in 75809 in Rowlett. And so if we just click there, and so it should show here. There's someone here by the name of Dr. Sean Anderson, Texas Tech in Amarillo. And it lists here, you know, Arlington. So many different ways that you can see who's actually active within the area that you live. So that's just one. And in regards to, you know, how you can even get other people that you know, like if you really love your doctor or you love your kid's doctor and you're like, I wonder if they know about this whole Walk with the Doc business. Not a problem. You can easily just, you know, get a flyer or show them, you know, the website, and maybe they'll start their own. And so in terms of starting your own walk, if there is not a chapter near you, you can also find this information on the website. And this actually, I think that doesn't show, that just talks about leading. I'm not going to show that video, but basically you can start your own by visiting the website, and it'll break it down for you in terms of all of the different opportunities. And as I said, you know, there's so many other organizations, medical programs, nursing programs, pediatricians that you may be able to see more often because of your kids. I mean, there's different networks out there. It's just a matter of brainstorming and trying to figure out what's most conducive for you. And that pretty much brings me to the end of the presentation. I was talking to Sarah earlier, and I did want to see if we could break out into different groups just for maybe about maybe 5 minutes, 5 to 10 minutes, depending on how much time we're allowed, and perhaps just brainstorm a little bit depending on where everyone is from and get some ideas for folks that may be interested in starting their chapter.
Thanks, Dr. Mohammed. I think we probably will have time for about 10 minutes, but before I put everyone in groups, I was going to open up 2 different groups for folks. Before we do that, I wanted to open up the floor if there were any questions before we go to the breakout rooms. Welcome back, everyone. Does anyone have any insights from their breakout rooms that they would like to share with the group?
We were wondering if our last part was the shacks, if the shacks had tie-ins with the medical community, because that might be a great way of tying in the Walk with the Dog program with specific groups like shacks. I don't know, Amanda, if you've heard of anything like that.
Yeah, that's a great question, Marissa. I have been trying to get involved in shacks, to be honest with you. I kind of was a little bit late in the game this year. I think that their last meeting was, on a day that I actually was out of town or something. But I do have a close relationship with a family physician that I'm on a council with through the Texas Academy of Family Physicians. And we've been closely actually working with shacks on ways to help high school students actually participate more in wellness activities as a kind of honor cord, the cords that all of the students wear at graduation, as sort of, a culmination of their time in high school if they achieve certain things. Such as exercise, community service, and things like that, they get a cord. And so in that regard, we've been working with the shacks. Specifically when it comes to Walk with the Doc, that hasn't been an opportunity that I've been able to have, but I would love that. And I do think that it would be a huge advantage to get the word out. So yeah, any kind of contacts or any suggestions that folks may have here, I definitely think that we could try to make something happen.
Dr. Mohammed, any suggestions on how to kind of approach our own physicians, doctors on how to bring up this topic and try to get them involved?
Yeah, that's a great question. I did have a friend of mine in another state that wanted to start a Walk with the Doc. And one of the things that pushed her was, she did have, a similar kind of situation like Dr. Sabgir did, where she was feeling like she wasn't contributing as much. And that was just kind of her open answer. I think that a lot of times there may be some slight level of intimidation, unfortunately, that we have as medical providers, from wearing a white coat to, just being called doctor. And I don't know, I feel that if I were to have a patient approach me with a flyer or some kind of information about a program like this and say, I was really, inspired by this presentation that I heard about of doctors that are able to give back to their community. And I feel like you would be a great person for this because I trust you. I trust the type of work that you do to keep me healthy. Would you consider maybe doing this? I'd be like one of the first people to show up. I think if it's kind of like an approach like that, like who wouldn't want to do that for their patients? And I feel like oftentimes we are really consumed, of course, in our day-to-day, struggles as physicians and also getting the things that we need to get done. But of course, not losing sight of the most important thing, which is trying to take great care of our patients. And this is one of the best ways to try to do that and show that through our actions. So I feel if you were able to present that in that way, with a little bit of information, which there's tons of free resources on their website. I can certainly help with that too if needed. I feel like they would be, a good response, and it's worth a try.
Great, thank you.
Mm-hmm.
Any other last thoughts before we close out for the hour? Well, thank you, everyone. Just a few little housekeeping mentions for this webinar. We do have an evaluation, so if you could take a few moments and fill out our evaluation. We did record the webinar, so Alice will be sending that out in the next few days, so be on the lookout for an email from her. And then I would be remiss if I didn't remind all of you that our summit is coming up. So the Texas Children in Nature Network Summit happens every year in December. And so we're going to be December 7th through 9th in Austin, Texas this year. I'm going to put a link in the chat on how to register for our summit. We have lots of tickets still available, and we are excited to see you all there. We'll be talking about lots of health and nature topics as part of that summit as well. And so, any last thoughts, Dr. Mohammed?
No, I think that's it. If you would like to contact me or have further questions, please reach out to Sarah. She can get you my information. But yeah, I just appreciate you all showing up today and asking such awesome questions. And yeah, hopefully we can, try to get the word out even more about this program. But thank you all so much for having me.
Thank you so much. And y'all have a wonderful rest of your afternoon.
Thank you. Bye-bye.
Bye.
Thank you.